Comprehensive pharmacy services. How hospital pharmacy leaders drive transformation.
The key foundation of an ambulatory or specialty pharmacy strategy within a health system is based on understanding the entire patient journey. So when we look at developing the specialty pharmacy or any of the ambulatory solutions, we're looking to see if the development of said service lines will actually improve the care of the patient. You need to consider two things. Are you interested in generating revenue? Are you interested in maintaining the care of the patient past the hospital? We recommend that you understand both those commitments and move accordingly. The CPS difference is really in the understanding of how ambulatory pharmacy fits within the healthcare ecosystem. Health systems have struggled to understand how the patient journey goes from inpatient to outpatient, how one gets paid. Our systems, when we're integrated together, really take into account all of those factors. We design and build, and then we implement the specialty pharmacy solution as a partner. Our goal is to get you to have the top SP ambulatory strategy in your region and impact patient care every day. The key to understanding whether specialty pharmacy works in your system is really predicated on three attributes. A, what is your 340B status? B, do you have providers on space? And C, what assets do you have as far as retail or infusion capability? Not all of those are required to be successful, but those are the attributes that we look at. It's important that we do a deep dive into your system to help you understand what is possible. Most systems have an opportunity. The size of the opportunity is determined by the way those attributes line up. So the key to understanding that entire ambulatory space is that everything is built on the back of a retail claim. So it's critically important that if you're going to do specialty, that you understand that you need to have a well-run retail pharmacy. Running a retail pharmacy is a tough business in today's environment. CPS has the tools and the people and the talent to help make sure that in and of itself, the retail pharmacy is a good business. When it comes to the ambulatory infusion space, we see tremendous changes going on in the space. These changes are moving patients out of the hospital outpatient departments and into other sites of care. This site of care shift is critical to understanding how it's going to impact your business. What CPS does is comes in and educates around all of these issues to ensure that it's not all about a specialty claim. It's about the entire ambulatory environment and how those three systems can work together. So you really can't do specialty without a retail, and in order to really do infusion well in the new world, you need to be able to dispense to those infusion centers. That capability is derived out of your specialty and retail pharmacies.
Hi, I'm Leza Hassett, Director of Corporate Compliance with Comprehensive Pharmacy Services. CPS has a wide variety of offerings to assist our clients, anything from operational analysis, purchasing analysis, clinical program analysis, as well as programs such as 340B, sterile compounding, medication safety, controlled substance diversion prevention. We'll come in and meet the client's needs based on the troubling areas or just looking for things that they might want to have further information on and gain a little extra expertise from our team. CPS has a wide variety of professionals across the pharmacy spectrum, from certified pharmacy technicians, purchasing analysts, clinical specialists. Most of us have practiced in the industry for several years, and that, combined with our collective experience as a team, can bring forward some really good practical experience So we can come in and perform an audit. We can look at what the client is currently doing and provide them with some really good implementable solutions to their issues, helping to elevate that client's practice to the next level, and a real passion for what we do and trying to make a difference every day for our clients. We don't want to just deliver a product or a report to the client. We want them to be able to implement those solutions that we're recommending. We want them to be successful. We want them to reach higher levels of practice and really make sustainable improvements. Our experience as professionals in the field just brings that practical experience. We don't want to deliver a report. We want to help them deliver results. When CPS comes in to do a consulting engagement, we go through the on-site process with the client, partnering with them through the entire process. We deliver a final report, corrective action plans, whatever recommendations that we might have. But we don't just drop that at the door and move on to our next engagement. We continue to support that client through a lot of their questions, the exploratory phases, and the things that come after that report is delivered. We make ourselves accessible. We provide resources to our clients. It might be template policies or clinical monographs or some kind of clinical trial that shows the benefit of one drug over another. We have great tools and resources that can really help that client take our recommendations and make them implementable solutions, and all of that is made accessible to our clients. CPS wants hospital pharmacies to excel. CPS offers 3 levels of 340B solutions: our basic audit services, continuous readiness program, and what we call a 340B assist. With our basic audit services, we offer a HRSA-like audit, just a limited one-time engagement coming in to evaluate the entire program. With our continuous readiness plan, it offers the client those services after the audit to help implement and track their progress towards any of the recommendations for findings that we had. With our assist program, we provide whatever services that client might be looking for. It's a cafeteria where we have a conversation with the client about what concerns they have with their program, what needs they might have, and then we tailor that proposal to meet those concerns. It might be covering for a maternity leave and doing some monitoring remotely for the client, performing a financial analysis to determine if the client would benefit from joining the 340B program. It really depends on the needs of the client, and we can bring any number of services to the table. We've got great expertise and talent on our team, and we can really customize that assist program to meet those expectations.
Hi, I'm Karen Alesch. I'm the Pharmacy Operations Manager with CPS Telepharmacy. CPS Telepharmacy has grown just in the volume of clients that we service. This growth has really allowed us to perfect our skills across each and every order entry platform that we work in. This expertise is something that we can then share on with the clients as well. If they undergo a system change, it allows us to change right along with them and sometimes even offer them some guidance on a system they may not be familiar with, but we have already become an expert in that system. We've also expanded our service line. CPS Telepharmacy was founded really on remote order entry and remote order verification. Since then, we've expanded our service lines to admission and discharge med reconciliation. We provide medication therapy management services, patient discharge counseling, follow-up calls with a patient once they've left a facility and gone home. We're really able to follow a patient from right when they're admitted to the hospital all the way through their stay while they're there, providing follow-up once they get home. CPS Telepharmacy really stands out from the competition in that we are 100% centralized out of a licensed pharmacy located in Naperville, Illinois. None of our pharmacists are working from home. They are all from that central location. We have pharmacists from all different backgrounds. We have residency-trained pharmacists with pediatric experience. So when it comes to collaboration and a difficult patient case that might be presented to us, we're able to pull from all of everybody's backgrounds to kind of put together the best team of pharmacists to tackle that patient in the moment. CPS Telepharmacy is also part of the CPS Comprehensive Pharmacy Services bigger organization that gives us access to the regulatory, the clinical side of things. Every aspect of CPS we are able to tap into if we need to. CPS Telepharmacy really works on the onboarding process to make the client feel like this is a partnership that we're developing. We don't want to be just another vendor. We really want to partner with the pharmacy and make nursing feel welcome in the process as well. We have a white glove service that we walk hand in hand with the client from start to finish and even beyond the go live date with follow-up meetings with the pharmacy. We'll sit in on nursing meetings, whatever it takes to make sure that the client feels comfortable with the service that we're going to provide. We meet with the CNO, involve them in the implementation process as well, because although we're partnering with pharmacy, we do know that nursing is really kind of that end consumer that we want to make sure that they're comfortable with the process as well. So the bottom line is, if CPS Telepharmacy is involved, we see an improvement in patient care and an increase in patient safety. This comes from the real-time verification of medications. There's a decrease in nursing overrides just because pharmacy is in there in real-time verifying those medications. We see an increase in the HCAHPS scores on the patient satisfaction surveys when CPS Telepharmacy is involved. Quality-related events are treated very seriously with our company. We have a monthly meeting that we discuss all of these quality-related events and really drill down to see what the root cause of that problem was. We'll fix processes on our side. We'll also relay information back to the hospital, so if there's process improvements that we see that they can make as well, we'll share that information with them so that they can make those adjustments. We provide valuable information to them that they can take to their P&T committee meetings involving the types of interventions that we're making overnight, the types of corrections that we're having to provide on those orders. We truly act as an extension of the in-house pharmacy. Whether it be day to night or night to day, that transition should be seamless with CPS Telepharmacy. We keep the patient at the forefront of all the decisions that we make and really just provide that continuity of care.
Hi, I'm Marcia Gutfeld. I'm a Senior Regional Vice President with Comprehensive Pharmacy Services. Once CPS forms a partnership with an organization, the goal is to come in, work with that organization and the Department of Pharmacy to do a series of assessments in several areas: financial, clinical, quality, regulatory, customer service, competencies of the staff, and even systems and processes related to how the staffing model has been created. The role of CPS is to come in and create an action plan based on those assessments we've performed. The second part of that goal is to help the organization actually implement that plan. We excel at implementation, and it's something that CPS is known for. And part of that implementation includes helping the staff be more comfortable or be more able to make those changes. So we have a robust learning platform for the staff in all things pharmacy, whether it's learning more about antimicrobials or it's learning soft skills and being able to better analyze data through an Excel program. So we are very proud of the fact that we're able to partner with an organization, identify an action plan, and help them reach those goals. I think it's important to level set as pharmacists what we've always been taught about how to evaluate drugs. So before we look at just the drug cost, we really need to look at the constellation of what that is. The efficacy of the drug or the drug classes we're looking at, the quality surrounding that drug or drug classes, and then the cost. And when we put those three elements together, we're always going to make the right decisions using data to help us analyze that information. It's a proprietary tool that CPS uses to help us with that. And in addition to that, CPS has a very, very robust library or intranet of documents that are all evidence-based. Literature, white papers, medication use evaluations, that combined with collaborating with prescribers, nurses, administration, and others, we make decisions and help guide those decisions and then actually help implement those decisions. Traditionally, the pharmacy's been viewed as a cost center, large expenses and drugs. But what we're seeing in recent history over the past few years is there's been a tremendous shift in expense to other areas outside the traditional inpatient model. Ambulatory care, in particular, is where we're starting to focus. Specialty pharmacy, retail pharmacy, infusion therapy, medication therapy management clinics. And this is an opportunity for organizations to pursue other revenue-generating situations. So the traditional model is starting to change. The focus for pharmacy is much broader than the traditional model.
For more information, visit cpspharm.com.